telling about jaundice syndrome and liver failure syndrome.
Okay, please, thank you. Start. This is our students. Okay. Okay, what is mean jaundice?
Jaundice is a condition which the skin, sclera, and mucous membrane turns yellow. This yellow color is caused by high level of bilirubin in yellow-orange bile pigment. Bile is fluid secreted by the liver. Bilirubin is formed from the breakdown of red blood cells. Types of jaundice, it can be characterized into three different categories, including pre-hepatic, intrahepatic, and post-hepatic. Causes of jaundice symptoms. Jaundice is often a sign of a problem with the liver, gallbladder, or pancreas. Jaundice can occur when too much bilirubin builds up in the body. This may happen when there is too many red blood cells dying or breakdown and going to the liver. Long-standing jaundice can be manifestation of vitamin B12 deficiency secondary to inefficient erythropoiesis. There is a need of establishment of treatment, guidance of vitamin B12 deficiency in children. Syndrome of bilirubin, people with Gilbert syndrome inherent a mutated gene that affects the liver's ability to process bilirubin, a waste product that forms during the breakdown of old red blood cells. Jaundice occurs when too much of bilirubin builds up in the blood. In this picture, you can see the differences between normal and jaundice person.
Okay.
Understand this picture. Yeah, it's a normal person and difference between a jaundice person. Its turns skin color is yellow.
Yeah. Causes?
Causes acute inflammation of liver, inflammation of the bile duct, obstruction of the bile duct, homolytic anemia, blood syndrome.
Okay. Symptoms?
Symptoms: itchiness, abdominal pain, loss of weight, vomiting, clear weight with stool, fatigue, dark urine.
Okay. Next. Okay.
Diagnosis of jaundice. Jaundice is caused by an accumulation of yellow-green substance called bilirubin in the tissue of the body, which causes a yellowing of skin, eyes, and mucous membrane. The condition can also cause other symptoms such as abdominal pain, itchy skin, headache, swollen abdomen, dark urine, and pale stones.
Okay. Next.
Different types of newborn jaundice. Physiological jaundice, the most common type of jaundice in newborns in physiological jaundice. Second point is breastfeeding jaundice. Jaundice is more common in breastfeed babies than formula-feed babies. Breast milk jaundice. Breast milk jaundice is different than breastfeeding jaundice.
Look.
Difference. Eyes color changes by yellow color. This is jaundice in man. This is jaundice in baby.
Okay.
Liver failure syndrome. Acute liver failure is a complex clinical syndrome characterized by coagulopathy, elevated liver biochemistry, and hepatic encephalopathy without underlying chronic liver disease. It is divided into hyperacute liver failure within 7 days, acute it is 1 to 4 weeks, subacute 5 to 12 weeks. Acute liver failure happens within 45 days, generally as a reaction to toxicity or a drug overdose. First one, inflammation, second one, fibrosis, and third one, necrosis, fourth one, liver failure. It is causes by the most common cause of chronic liver failure.
Talisha, please stand this side. Okay, thank you. Yeah, okay. No, Nia. Yeah.
Shade is here.
Okay. Okay.
Liver failure induces hepatitis B. It makes your liver swell and stops it from working the way it should. Hepatitis C, if you have it long term, it can lead to cirrhosis, long term alcohol consumption.
Now
It also
I'm
leads
giving
to
questions. What is that?
the causes of liver failure.
Okay. Causes liver failure disease. Acute liver failure. Okay, read. First,
First one,
drugs. Second,
viral infections, poison, MISC, and cryoprepitin.
Symptoms. If your patient have liver failure, these symptoms.
Jaundice are yellowing of the eyes or skin, pain and distension of abdomen due to the release of a fluid from the liver, swelling of the lower legs due to retention, confusion of a forgetfulness, color, dark yellow colored urine, pale colored stool. Laboratory and instrumental methods of diagnosis of pathology of digestive system. Standard imaging test for gastric conditions include upper gastrointestinal series, ultrasounds, MRIs, CT scans, X-rays for an even clear picture of gastrointestinal tract. A bilirubin swallow or bilirubin enema may cause congestion of an X-ray. In laboratory test, fecal aggregated blood, fecal immunochemical test, stool culture, other stool test, leak test.
Okay. Next.
Pathology test for the digestive system. Colposcopy is the procedure that allows the healthcare provider to view the entire length of the large intestine. It's a colon. It can often help identify abnormal growths, inflamed tissue, ulcers, and bleeding. It involves inserting a colonoscope, a long, flexible Leiden tube through the rectum into the colon. You see in this picture.
Yes, this picture, colonoscopy. Yes. Instrumental diagnostic.
Of digestive system.
Yeah.
Colonoscope.
Colonoscope.
In colon.
This is very, very painful. Okay.
Diagnosis test for gastrointestinal disorders. It's a clinical examination, blood test, stool analysis, endoscopic procedure, variant swell, CT, colonography, and visual colonoscopy, MRI scan, ultrasound, renal and functional test, podometry, pH monitoring, and breathing test. It is a 12 diagnostic test for gastrointestinal.
Okay.
Indication and contraindication. Contraindication in medicine. A contraindication is a condition that causes a reason not to take a certain medical treatment due to harm that it would cause the patient. Contraindication is the opposite of indications, which is a reason to the use of certain treatment. In indication of patient use, in medical terminology, an indication for a drug refers to the use that drug for treating a particular disease. For example, diabetes is an indication for insulin. Another way starting this relationship is that insulin is indicated for the treatment of diabetes. Contraindications that prevent treatments. Contraindications: skin disease or disorders, hypersensitive skin, bursting, swelling, acute inflammation. Avoid any areas with the cuts, and abrasions. Recent operations in the concerned areas. Recent fractures of the concerned areas. Epilepsy, recent scar tissue, tumors or unrecognized lumps. And the differences between indications and contraindications. Closed wounds with high complication rates. First one, traumatic wounds, joint replacements, amputations, vascular leg incisions where there is motion producing here. There is forces in knee and hip regions. Edematous closures. Incisions that are leaking fluid, edematous and congenitally. Wound edges well approximated. In contraindications, wound with infection, dehiscence, cellulite. Surgical incisions with edema and fragile surrounding skin due to the steroid radiation therapy or patient age.
Okay.
Okay.
Thank you so much for our student. Respect. Okay, please don't close. Give questions. Give questions for student. Talesha. Okay, give question. Okay.
What is the symptoms of jaundice?
Okay. Find one student. One student. Tell name. Who is Srihari. Okay.
What is the symptoms of jaundice?
Appearance of yellow of face and nails and eyes and yellowish of the stones.
Next question, all the student.
Power. Causes of jaundice. What is the causes?
Causes.
This is caused by mainly the leakage or deposition of the bile enzymes in the stomach.
In stools? Causes. Why this patient starting?
Acute inflammation.
Acute inflammation, what? Liver? Okay, and true? True or
High
not?
deposition of bilirubin in blood.
Higher deposition bilirubin in blood. Why? Which situation? Which situation? Okay, next question. What is mean liver insufficiency? Liver failure disease. Anjali. Anjali or Lilanjali? Lilanjali. Liver failure causes. What is mean liver failure disease? Okay, all the students. Tell all the students. Rafael?
Yes, ma'am.
Liver failure.
What?
Give question again.
Liver failure syndrome.
Liver failure?
Syndrome.
In liver failure syndrome, there will be like liver functioning will be damaged, and for liver failure, we have to take different kinds of treatments like liver transplantation. If there is a liver failure, there will be decrease. There will be effect on the detoxification of harmful chemicals from the body, which will be a dangerous situation.
Okay, thank you. Next question, give. Okay, good. Taliasha, give question. Next question.
Laboratory. What is
Give question.
Naveen?
Naveen. Okay.
Laboratory test for digestive system. Pathology of digestive system. What are the laboratory tests?
This is means if you in digestive system have any diseases, which laboratory, which instrumental research?
CT scan and X-ray, UGI, upper gastrointestinal.
Okay. Okay, thank you, Taliesha. Thank you. Next, Aishwarya.